Hi everyone, I'm finally back, kind of. So I just slept all day, like until 5 p.m. Went to bed at midnight and I slept till 5 p.m. So that's my life. I'm super busy. As most of you know, I started my job as a registered nurse in June and I recently just started going back to school for my bachelor's degree. I do not have my bachelor's degree yet, obviously, but I am going to Alvernia online for that. I just finished my first two courses like last week. I got A's in both courses. Meanwhile, I feel like I am so exhausted. When I have off, I sleep all day, and that's not what I want to be doing. I'm sorry, I have these things under my eyes. They're the Ulta Beauty 24 karat gold and hyaluronic acid. They're like eye masks because otherwise your girl would look so tired, and I am tired. I'm actually getting ready to go out right now. I'm gonna do my makeup. While this is like doing its thing, I just wanted to sit down and like talk about some things, mainly just about a lot of questions I've been getting about like my job and other things going on in my life. I'm trying not to get like too into it and like too personal and too like emotional about everything that's going on, but just so I don't get so many questions anymore, because the questions get old and just like really repetitive, and like it's whatever, I still answer the questions, but it does get like exhausting when you're already like exhausted, you know what I mean? So I've been getting a lot of questions about like my job and stuff. Mainly when I see people, when I like go out when I'm not at my job, they are like, oh, like how do you like your job, like how do you like nursing, oh you're an RN, like all these questions. And I get a lot of questions a lot, and it's very overwhelming sometimes, and I kind of just wanted to talk about that. But before I talk about that, I just want to like rewind back to like when I started. So I got my nursing license in May. I graduated in April. I started my job in June. I know that's kind of like all over the place, but basically I started my job in June. I was in training on day shift for like a month and a half ish, a month, and then like I went to night shift. I do currently work night shift, like 2 or 3 12-hour shifts a week. I am hired part-time, but I've been working like full-time hours. Drink to that. It's just coffee, by the way, not alcohol. I can't complain too much about my job. I've been on my own. Like I don't have a preceptor. I've been off of training since the beginning of August, so I've been on my own for like 2 months. It's been going well. Not like anything too crazy has happened in my experience, but I got a lot of questions about like where I work. Everyone just like, when you tell people you're an RN that works at a hospital, everyone just immediately thinks like emergency room, which is not where I work. I work on a medical surgical unit where we see like medical patients where like maybe they fell at home, maybe they have a UTI that needs IV antibiotics, maybe they're septic from a UTI, from pneumonia. I understand what that is, but that's what we see. And if you don't understand what those medical conditions are, like go look them up, because I explain them like a million times a day. And anyway, we also see surgical patients on top of medical patients. Mainly we see urology patients, nephrology, gastroenterology, infectious disease. So urology is like surgeries on your like urinary tract. So it could be, they could be putting stents in to open up your urinary tract, like bladder cancer, prostate cancer, UTIs, urinary retention from like enlarged prostates. We do a lot of catheter care, a lot of putting catheters in, like urinary catheters. We do a lot of that. Nephrology, we got a lot of patients on dialysis. We don't do hemodialysis, like where they take the blood out and go through the machine. They do that on another floor, but a lot of our patients we do send to dialysis Monday, Wednesday, Friday mornings if we have them as our patients. And then we do peritoneal dialysis on our floor. Actually, I'm actually trained in that, and I do that. If I do have a patient that's on PD, I am allowed to do the PD, and basically it's just fluid that goes into their peritoneum, not peritoneum, their peritoneal cavity in their abdomen, and it basically takes all the fluid out. Their kidneys cannot excrete because they're in renal failure. So then that comes out through another tube, and that's like a whole thing. If you don't know what PD is, or peritoneal dialysis, look it up because it's a whole process, but I am allowed to do that, and I do that. What else? We get a lot of like open abdominal surgeries, a lot of laparoscopic abdominal surgeries, appendectomies, cholecystectomies, nephrectomies, a lot of like cellulitis, a lot of diabetic foot ulcers, a lot of osteomyelitis, just a lot of things. Abscesses, like anywhere in your body, drains coming out of those, stinky fluid coming out of those sometimes. You see a lot of things, and there's a lot of things to see on my floor. And we give a lot of IV antibiotics, we give a lot of fluids, etc. So it's a lot. And people ask me all the time what I do. That's kind of what I do. A lot of IV antibiotics, a lot of fluid, making sure everyone's up walking around, doing their incentive spirometer, PCA pumps, narcotics, and a PCA pump like morphine dilaudid, and that like continuously sometimes pumps. Usually it's not continuous, but like the patients have like a button and they control their pain through that. We just see a lot of that. TPN, which is like nutrition through your vascular system if their GI system is not working. PEG tubes, feeding tubes, NG tubes. What else? I don't even know, but like all those things, if you don't know what they are, look it up, because I could go on all day telling you what these things are and what they do. So basically it's like all these things. We do a lot of wound care too, like a lot of wound care, like wound packing, wound dressing, treatments depending on the bacteria or like the fungus. Yeah, I know it sounds gross, and it is gross. It is. We see a lot of different things, and that's why I wanted to work on this floor that I work on, because you do see a lot of things and you do get a lot of experience, and I've learned so much since nursing school just in these past 4 months of working as an RN alone. But anyway, yeah, that's the main thing I get is just like, what do you do? And I don't work in the emergency room. I really don't want to work in the emergency room. I thought I did, but I don't. I heard it's crazy down there, and my floor is crazy enough sometimes. Oh yeah, dementia. Get a lot of dementia, and a lot of, how do I want to say this nicely? A lot of patients with cognitive impairment. So sometimes it's not always dementia. Sometimes it's just like they have an infection going on, and when older adults get infections such as a UTI, they get confused because their electrolytes are off, they have an infection going on, like usually they're septic, and that can just lead to confusion, delirium, blah 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 blah. And sometimes patients get a little feisty. It happens. It's fine, we make it through. Some confused people are like the sweetest, and some just aren't. Generally, I am happy at my job. I really am. And I am so grateful to have the job that I do and the opportunities that I have. And I'm so glad I got through nursing school, because I heard it's getting harder for some people to make it through, and it's just not fair. Like, I had it pretty good when I was in nursing school. My parents supported me a lot, and I didn't have to work that much, so I had more time to put into school. And now I'm really understanding, because I go to school full-time and I work mainly full-time. So it is a lot to take care of, especially when people have kids, which I do not, but I get it. Another thing I want to talk about is when you have things going on at home and then you have to go to work, and then like things at work remind you of things at home, and then things at home remind you of things at work, and then it's a mess. But I lost my grandfather 2 months ago, And since then, I've been really sad a lot of the time. And that week I went back to work was awful. I didn't think I was even gonna make it through the first shift back. And I had to call off work like 2 months into my job. I just couldn't handle it. Like the patients we see, a lot of them have prostate cancer. A lot of them have cancer, and that's what my grandfather had. That's why he ultimately passed away. And I get a lot of patients with prostate cancer, and I just see what they're going through, and I understand why my grandpa didn't want to get treatment, because it's a lot and it's painful and it's uncomfortable. It's upsetting. It really is. It's just not gonna end. I mean, I work on a urology floor. That's what we see. But it gets to me every time I work, and I try not to think about it. But it's hard not to. It's just rough. But anyway, we get through it. We do what we gotta do. And if you know anyone who's a nurse, just listen to them. Just respect them when they don't want to be talked to, when they want to sleep. Just respect them, because you have no idea what goes on at work. You have no idea unless you're actually there. Unless you're a nurse and you get what I mean. You don't know what's going on in the hospital, and you don't know the things we see, and you don't know how much it affects us. And it's tough stuff. I can't really say more than that. It is a lot of responsibility and a lot to take care of. So yeah, just take care of your nursing friends, your nursing wives, your nursing husbands, your nursing boyfriend, girlfriend, whatever, because they are going through it, I promise you. And thank God for my family, thank God for my friends, because I don't know how I would do it without them. I honestly don't. Well, it's future me editing this video right now, and I just watched that all, and I went from being like such a brat honestly about saying like go look up these like conditions, because I'm not gonna tell you what they are. I was probably in such a bad mood that day, but honestly, like, it would take so long to explain all those medical conditions and stuff. But honestly, if you have any questions, medical conditions, you can ask me, or you can just Google it. Those are like all the things that I see from day to day, but it mainly is patients with bladder and prostate cancer. That's mainly what we see. And yesterday into today, I literally slept 16 hours and have like 4 assignments due tonight for school. And I woke up at 3 a.m. and I did all my assignments, and now I'm like done for the day doing my assignments. But that's like my life now, I guess, just sleeping, working, and doing homework. But yeah, I am generally happy, and thank you guys for watching. I know I look crazy. I usually don't look like this. I really wish like that whole video I like had makeup on and like looked half decent, and I wish I did now too, but that's just like usually my life, but not today. Hopefully my next video I make, I will have makeup on, or like will do my makeup for you guys, because I know that's what people really want to see. But like, I felt like this was more important first, because I get questions like every day about like nursing from just my family, friends, from people that just like message me saying like, how's nursing? And like, they're like, oh, do you work in the emergency room? Like, do you work post-op? And I just want to clarify this again. even though I said in the beginning of the video, I don't work in the emergency room and I don't work in recovery from surgery. I work after recovery, after you're waking up from anesthesia. If you have to stay inpatient in the hospital, you come up to my nursing unit, and there's a couple others in the hospital that I work at, but you come up to our unit, we do your vital signs, give you pain medicine, look at your wounds, look at your incisions, make sure you're walking, make sure you're breathing, all that kind of stuff. And that's basically me. But then we also see people that aren't there for surgery reasons, and that's why my floor is called medical-surgical. Okay? Okay. I don't mean to be like that, but that is why my unit is a medical surgical unit, mainly surgical, but we also see medical. Okay? And thanks for watching my video. I'm sorry I look ugly, but have a good day.